Now, as you know, we always promise you that we keep within a timeline for this evening. So unfortunately, you're going to have to hear my introduction while eating your dessert. And it's okay if you make a little noise with your dessert while you're listening to me, because I'm not the main course, but hopefully you'll be done by the time our speaker takes the stage. Of course, we're very pleased to have all of you here with us this evening. Scholars, practitioners, public servants, politicians, students. Many of you have come to previous lectures, and believe it or not, this is the 6th lecture in the Tansley lecture series. We began in 2008. Now, it will be my pleasure and honor to introduce our special guests from the United Kingdom. But first, allow me to say just a few words about the lecture itself, and in particular about the individual it's named after. Donald D. Tansley was born and raised in Regina. Immediately after graduating from Central Collegiate in 1943, he joined the Army to fight in World War II. He just turned 18 years of age, but he would grow up fast. He fought in the D-Day invasion. He fought through Belgium and France and into Germany. And in fact, in 2005, after years of silence, decades of silence about his experiences during this time, Tansley published Growing Up and Going to War, one of the very best war memoirs that has really ever been written in this country. His difficult experiences made anything in the civil service seem easy in comparison. In fact, he became very well known for tackling some of the most difficult and often thankless jobs in the public sector. He spent over a decade working in Saskatchewan's famed Budget Bureau, in what was then known as the Treasury Department, and I think that's still the name used in the UK. Tansley's rise to Deputy Provincial Treasurer was interrupted when he was put in charge of rescuing the Interprovincial Steel Company, IPSCO. And that company is today Evraz, which is the largest steel manufacturer in Western Canada. Now, what was his reward for pulling off this miracle? Well, he was given the almost impossible job as chair of the Medical Care Insurance Commission, just as doctors were preparing for the 23-day strike in protest over the introduction of universal Medicare. Later in life, he was fond of saying that he should have received danger pay with the assignment. In 1964, Tansley moved on to a somewhat more pleasant job in New Brunswick, where he was Deputy Minister of Finance and Deputy Minister to Premier Robichaud. And he was put in charge of modernizing the government and the machinery of government, as well as implementing the Robichaud government's program of equal opportunity. In 1968, he moved to Ottawa and the federal government, where he would go on to have a stellar career. As Vice President of the Canadian International Development Agency, he took a 2-year leave of absence to review the operations of the International Red Cross. He produced a far-sighted report on how it needed to reshape itself and its role. The report was very unpopular in some quarters. Major change generally is. But it is widely acknowledged that if his recommendations had been adopted, implemented by the Red Cross, that organization could have avoided major problems in the decades that followed. So, what was his reward for this job that he did so well? As usual, another hard job. Prime Minister Trudeau made Tansley the administrator of the highly unpopular Anti-Inflation Act. And after this job, he was appointed the very first deputy minister of a new Department of Fisheries and Oceans. An interesting posting for a Regina-born boy who did not actually see the ocean until he sailed to Europe as one of the youngest members of the Regina Rifles. Now, given declining fish stocks and battles over international boundaries, Tansley faced his share of headaches and heartaches. But through hard work and perseverance, he gained the loyalty of the civil servants and the scientists in his department, a number of whom actually remained loyal friends until his death in 2007. We've named this lecture after Don Tansley in order to highlight the various approaches used by governments to implement policy decisions and manage programs in times of great change. Now, sometimes these approaches either require a major restructuring of the machinery of government or a reorientation of the public service. Our lecturer tonight, Peter C. Smith, was selected so that we can better understand the intensive use of strategic targeting and performance management in the context of what was really a major experiment in the United Kingdom. This required both a change in the machinery of government and, significantly, a change in the orientation of both the political and the bureaucratic tiers of government. Peter Smith is currently Professor of Health Policy in the Business School at Imperial College, London. He is also the co-director for Health Policy in the Institute of Global Health Innovation, where he manages a large staff of researchers and graduate students. He received his own graduate education in mathematics and economics at Cambridge University, where he began his career as a young lecturer. He then moved to the University of York, where he eventually served as director of that university's renowned Center for Health Economics. Peter Smith has acted as an advisor for government from the beginning of his academic career. He was a board member of the Audit Commission in the UK, and he has advised the International Monetary Fund, the World Bank, the European Commission, the OECD, and the World Health Organization. In fact, that's how I came to know Peter, in a special operating agency of the WHO known as the European Observatory on Health Systems and Policies. He is currently a member of the National Health Services Cooperation and Competition Fund. He has published extensively as an academic, drawing upon his work in government. He has over 100 peer-reviewed articles in the top journals in his field, including Health Economics, Health Affairs, Evaluation, the Journal of the Royal Statistical Society, the British Medical Journal, and the Lancet. He's also written various books, including the Oxford Handbook of Health Economics, Healthcare Systems in Developing and Transition Countries, Measuring Efficiency in Healthcare, Performance Measurement for Health System Improvement, and, some of you might be very interested to learn this, Formula Funding of Public Services. As you are about to hear, Peter Smith played a key role in advising Tony Blair's government on the public service agreements. He was a member of that government's Performance Information Panel, which was responsible for overseeing the targets set by government as well as the measurement instruments that were used. And he was subsequently asked to consult on the detailed implementation of targets in the Department of Health and the NHS. Would you please join me in welcoming Peter Smith this evening for this year's Tansley Lecture.
Thank you very much, Greg, for those very kind and generous and half-true words. Thank you. It's a great honour to be here in Canada, in Saskatchewan, and the school. And I'm very honoured and grateful for the invitation, and thank all of you for that. And also thank in particular Greg for his great help in preparing for this talk. It's somewhat humbling to hear about the illustrious predecessors, and a bit scary actually, that I follow. Not least Donald Tansley, who I think if some of us had had a fraction of that experience, we'd feel that we'd led a very full life. It's been very enjoyable visiting the school here, very fulfilling and interesting, and the posters really demonstrate a very vibrant and interesting student group, and I congratulate you all for that. So it's not unusual for an academic to have to sing for his supper, which I'm doing right now, but also you've got to listen to for your supper, so that's just too bad. But I will stick to my target of timing that Greg has given me, and I'll make sure I don't overrun that. That does mean that I may skip some parts of my talk, but the talk will be available, I presume will be available on the web fairly soon. So I don't need to tell this illustrious audience, with all its knowledge and wisdom and experience, about the pressures that public services are under. They are always under pressure because there will always inevitably be public resistance to paying taxes for services, many of which the citizens who are paying the taxes do not receive the benefits, or at least do not perceive the benefits. So there will always be these pressures. But it's become particularly acute in recent years. I've worked mainly with European countries, and some of those countries are under the most intense pressure. And this pressure has led to increased interest in what is increasingly being seen as one of the key issues in getting the most out of public services, and that is the issue of governance. Now, I think of governance as comprising three fundamental elements. Governance comes from the ancient Greek word, which I shall not try to repeat, but it's the ancient Greek for steering. And I think there are three fundamental issues that need to be in place to be able to steer the ship of state. They are setting priorities, measuring attainment of those priorities, and thirdly, and perhaps most difficult of all, putting in place accountability arrangements so that you can stimulate corrective action when circumstances demand. And it's that bit of the steering that is proving so difficult in so many of our systems of government. So I'm going to talk about one of the most radical and controversial efforts to improve the governance of public services, which was attempted by the UK government under the Labour Prime Minister Tony Blair. He and his colleagues had a pretty good idea what they were going to do. They did a lot of preparation for this in opposition. And they sought to revolutionize public services by putting in place explicit objectives for every ministry and setting measurable national targets against which the performance of those ministries would be evaluated. And this system was known as the Public Service Agreements, or PSAs, as I'm going to describe them throughout tonight. And each ministry was periodically held to account by its performance against the objectives that it had been set, the targets, measurable targets, and its performance against those targets. Now, as an academic, I had a long-standing interest in performance measurement. I'd studied this very early on. I'd always been amazed at the extent to which, at least in the UK, governments and those responsible for running public services paid so little attention to issues relating to performance. They seemed to be much more concerned about keeping the show on the road rather than making it a good show and a sustainable show. So I observed this PSA experiment with great interest because it did seem to be a really radical attempt to try and pay serious attention to what governments were trying to achieve and whether they were achieving it. As Greg said, I played a part in a number of contexts as this unfolded and served in several roles in the detailed implementation of the targets, particularly in the health domain, where most of my recent research has been done. But I ought to say that before I worked in the health area, I also worked in local government more generally across the whole of public services. So this was a major departure for UK public services, and as far as I'm aware, in any modern democratic state. It sought to introduce a level of rationality and transparency to policy making that was really very unusual. And it did, without question, deliver some benefits, as I'll describe, both in the planning and delivery of services. But it also, over the 12 years in which it was in place, it led to some serious tensions within those services, which really make us pause to think about the limits of rationality and objectivity within our design and running of public services. The system of PSAs was abandoned with the arrival of a new coalition government in 2010, which was led by the Conservatives with the support of the Liberal Democrats. But there remain many important legacies of the PSA experiment. And indeed, we're finding that some elements of the current government are finding it necessary to return to some of the principles that have been put in place using PSAs. So, I'm going to talk a bit about the system, describe some of the experience in the health domain, and then pose some questions that this experience has given rise to. So the Blair government came to power in 1997, immediately put in place arrangements to start setting these targets for the ministries. It was led by the Prime Minister's office and the Finance Ministry, which, as Greg says, we quaintly still call the Treasury. These PSAs were first announced in 1998. Now, it turned out in this first round that over the whole of government, I think it was 27 ministries, there were 600 targets set, 600 objectives and targets. The objectives of setting these targets were of offering a clear statement of what each ministry was trying to achieve, giving a clear sense of direction and ambition, introduce a focus for delivering results, forming a basis of deciding what was not working, and improving accountability. That was the stated set of objectives. And these PSA objectives were intended to have a number of distinctive features. They were to be expressed in measurable form, And there was to be a numerical target that the ministries were expected to achieve within a fixed time frame. And the other distinctive feature was that these targets were supposed to focus on the outcomes of services and not the processes. That is, much less emphasis on actually what the ministries were doing, more on what they were achieving. However, this first set of targets in 1998 was a bit of a mixed bag. And indeed, the initial targets for many ministries were related more to processes or procedures than outcomes. So, for example, a target for the Ministry of Defence was to create a new joint rapid reaction force, which will be fully operational by October 2001. So, not really much about outcomes on that one, although actually I'm not quite sure how you would express outcomes for a defence ministry. Number of wars averted doesn't seem to be particularly vulnerable to auditing, but maybe I'm wrong. So PSAs were reviewed every 2 years, not in quite as much detail, but the first review in 2000 recognised there were far too many objectives and targets. This is, I think, an inevitable function of governments and politics, that it's very hard, and those who actually do this, I'm sure, will tell me why this is, but it's very hard to say that something is not a priority, because there will be some group for whom it is, and it's very difficult for politicians to say, actually, it's very important, but it's not our number one priority. But the second set of PSAs did reduce the number of targets from 600 to 160. They were subsequently reduced to 130. So there was increased focus. They did become more focused on outcomes, and they were increasingly measurable. Furthermore, it was realized after the first set that nothing was going to happen unless there was some sort of enforcer in place. And so, with the second set of targets, the Prime Minister set up what was called, politely called, the Prime Minister's Delivery Unit. I will not tell you what it was called privately by the ministries, but they weren't necessarily welcomed at all times. The formal role of this Prime Minister's Delivery Unit was to improve public services by working with departments to help them meet their PSA targets consistent with fiscal rules. That is, they were trying to get them to focus on these targets and keep to their budgets. So that continued for, in total, a 10-year period, until the system was subjected to another fundamental review in 2007 under the new Prime Minister, Gordon Brown. This review retained the principles of PSAs, but recognised that one of the most difficult problems with government was the problem of not departments' targets. Departments could be persuaded to, generally speaking, to focus on targets if they were given enough pressure. The real problem, and the things that had been neglected, were the cross-departmental targets, the cross-sectoral problems. So, for example, so the 2007 review focused almost exclusively on cross-sectoral targets. And the sort of thing they had in there was, one of the objectives was to build more cohesive, empowered and active communities. Another one was tackling poverty and promoting greater independence and well-being in later life. These are really important cross-sectoral issues, but you can see that they are rather vague, rather difficult to pin down, certainly difficult to measure, but most important of all, difficult to really get a single ministry to focus on these. So although each target was assigned a lead ministry, I think it's fair to say that the rather general formulation of these cross-sectoral targets led to a diminution of focus and impact of the PSA regime after 2007. I also think it's fair to say that the banking crisis that hit the UK particularly hard at that time and became the preoccupation of ministers and the Prime Minister also distracted attention from PSAs. I don't know whether this was covered in Canada, but our Prime Minister, in a slip of the tongue, stood up in Parliament and told Parliament that his actions on the global financing system at that time had saved the world. And so he obviously wasn't particularly focused on ministerial performance at that time. So to illustrate how targets work, I'm just going to spend a little diversion on the Department of Health targets, the Health Ministry. Our Health Ministry is one of the biggest parts of public services and one of the most complex. I'm sure most of you who work in government will have be aware of some of the complexities there. And I'm sure the Canadian provinces, in fact I know the Canadian provinces, suffer from many of the same challenges as the English health system and many other health systems. I am incidentally just going to talk about England for the health side of this talk. So, in common with other ministries, the Health Department would set strategic targets in the form of PSAs from 1998. Now, there were 4 broad areas of targets that they were set, but one of the most important ones was to treat people with illness, disease, or injury quickly, effectively, and on the basis of need alone. So that's the overarching aim, and that was converted into specific measurement and targets. And the sort of measurement that was proposed, this wasn't the only one, but it was one with a lot of focus, was to reduce the maximum wait for an outpatient appointment to 3 months and the maximum wait for inpatient treatment to 6 months by the end of 2005. Okay, so these might seem quite long waits, but we're talking about the maximum wait here at a time when people were still waiting 18 months for treatment. And I'm sure that sounds shocking, although I do understand parts of Canada do have some really severe waiting time problems, but I think UK at that time had particularly appalling ones. So that was 6 months for an inpatient treatment in that one. 2 years later, this was tightened to say that no one should wait longer than 3 months. And finally, in 2004, that wait I've just mentioned was for people from the time that it was decided treatment was needed to the time when they actually received the treatment. In 2004, the target was tightened still further, and it became no one should wait more than 18 weeks from the time that they were referred by their general practitioner through to eventual treatment. So that includes the outpatient visit, any diagnostic treatment and treatment. Maximum time, 18 weeks. And that actually has been retained. That is now embedded in our what's called a legal document known as the NHS Constitution. And although it's coming under a lot of pressure, it's creaking a bit, that target is still being widely respected. So these were quite extraordinary improvements in the required by the Health Ministry, and by and large they made it. How was this achieved? Every provider of healthcare was given a star rating. The Health Ministry devised a system of star ratings for every hospital and other provider, and a key part, this was a very complicated calculation of how well they were performing, but really waiting times formed a key part of that calculation. And so every organisation was ranked 0, 1, 2 or 3 stars. And if you were 3 stars, generally speaking, it was because your waiting times were good, you were respecting the targets, and you had some rewards in the form of increased autonomy and reduced regulation. But there were also some strong negative managerial incentives for those who were performing poorly. And indeed, when the first set of star ratings were published, the Health Minister pulled in all the managers of 0-star organisations and told them that if they did not improve in 12 weeks, that their jobs would be under threat. And indeed, many chief executives did lose their jobs throughout the PSA system if it was considered that their rating of their organisations could not be explained and excused. So really strong managerial incentives to respect the targets set by the Health Ministry, which in turn, of course, those targets have been set by the Prime Minister and the Finance Ministry. So how did the workers in the health sector respond to these targets? Well, as you might imagine, they weren't entirely positive in their views. I have to say that managers were more mixed. I think there were quite a large number of managers who actually find the targets very helpful. They were instruments which gave them focus and which enabled them to filter down throughout their individual organisations the priorities that they had to attend to. However, it's fair to say, I think, that the reaction amongst professional staff, notably doctors, was less positive, and indeed there was a widespread view amongst doctors that targets were distorting clinical priorities and undermining professional autonomy, which in some ways was the intention. In some ways, the targets were there because traditional ways of working were not delivering what politicians perceived to be the priorities for the service. Now, I think, I'll come on to this a little bit later, I think you could well argue that actually the clinical outcomes of medical care are really absolutely crucial and indeed maybe should be trumping waiting times. But I think the political perception of what the priorities were was that the issue that was concerning citizens and therefore concerning politicians was the waiting time. So there's no doubt that these performance ratings were delivering major improvements in the aspects of NHS care that they targeted. There was the very long waits for non-urgent inpatient treatment disappeared. In 2001, this is a survey by an organisation based in New York called the Commonwealth Fund that does an international survey of ordinary citizens, a random sample. It's a very interesting comparison, and Canada has taken part from the beginning. New Zealand, Australia, UK, and US are the others who were the starting countries. So they found that in 2001, only 23% of UK patients waited less than a month for their treatment, for non-urgent care. 23%. Incidentally, at that time, the Canada figure was 37% got treatment within a month. The UK had improved by 2010 to 59% receiving their treatment within a month. Canada had barely moved. It's the same amount. So it was 35% in 2010. So compared to all the other countries actually in the sample, the UK improved markedly in that time. And I would argue that it was the targets that secured that improvement. But it's also fair to say that some of the other health targets did not have the same level of success. One set of targets related to the health of the population and, for example, life expectancy and reducing health inequalities. These are some of the most difficult challenges confronting health systems. And of course, a large part of the problem is that life chances, life expectancy and health, a large part of the cause of poor health and poor life expectancy lie outside the control of the health ministry. And so it's hardly surprising that it's much more difficult to get a grip on those sorts of targets than it is on things such as waiting time, which are within the direct control of the ministry. But there were also, in spite of the successes though, I have to say that there were some very distinct problems. And perhaps the most serious challenge is illustrated by events that occurred in a hospital in the English Midlands called Mid Staffordshire Hospital, where a recent report has laid bare some really severe failures. And there are estimates that there were several hundred of excess deaths in that hospital. And the public inquiry into the events at that hospital report the development of a culture in which pursuit of targets and adherence to financial budgets completely drove out the usual compassion and concern with clinical outcomes that one would expect in a hospital. And this appalling case, and there are some dreadful case histories which I certainly deserve much more consideration than I'm able to give them. There is an open question as to the extent to which the target regime could be blamed for this. One could argue that the development of a corrosive culture in a hospital is much more a problem of governance and so on than the specific targets and priorities that have been set there. Nevertheless, I think it is a cautionary tale about the risk of excessive reliance in the public services on explicit targets and management by objectives. So, the experience with PSAs in the health domain were largely replicated in other ministries. There were successes, for example, in schooling, where numeracy and literacy in schools did improve over the targets period. But in other areas, such as the environment and defence, there were profound measurement difficulties. So, mixed experience, but some very definite successes. So, what is the verdict on this 12 years of experience? Well, I'm going to just ask 6 questions about the operation of targets and point to these as being particular issues that I think need more attention if we're to pursue this sort of methodology. I'm going to raise them as matters for discussion rather than questions on which I've got particular answers. So the first is, who should choose targets? Now, in principle, it seems to me perfectly reasonable and honourable that a legitimately elected government should be the one to choose to set out its objectives and targets in an explicit fashion. In fact, you could even argue it was rather brave of that government to say what it was going to achieve, what its priorities were. And the government could then be held to account by Parliament and the electorate. But there was a persistent argument that actually others should be involved in setting targets. For example, the professionals delivering the public services, and indeed service users should be those who contribute. This is something I do have a view on. I actually think that although those constituencies, those stakeholders have some role to play, it seems to me perfectly reasonable that it's the role of politicians to make choices, and if they feel able to set out those choices in the form of explicit objectives and targets, so much the better. Secondly, what targets should be chosen? Multiple objectives are a characteristic of public services. Indeed, you could argue that's why they are public services, and they're not. It's not possible to put them in the private sector. But one of the intentions of PSAs was to focus on a limited number of objectives, and that really requires some tough political choices. I think the experience with the PSAs was that targets should be focused on things where you really need to change the services. It's where manifest change is needed. If it's just a matter of sustaining existing standards, then there should be other mechanisms for keeping that in place. And it's interesting that the most successful ministries did not allow targets to distract them from the bread and butter of the other standards that they had to achieve. Thirdly, is this really right that we should be focusing on outcomes as the basis for targets? They obviously are the things that matter most to service users and the broader public. They're not worried about how services are delivered, by and large. They're interested in whether they get a good service and it makes students get good grades, or people get better when they're sick, or it reduces levels of crime. And they're not particularly interested in the methods that are used to do that. So I think outcomes should certainly inform all of our measures. But on the other hand, it became clear that in some domains, the use of more limited process variables was helpful, because the actual outcomes were going to be so far in the future, or they were so diffuse, it was really difficult to hold a ministry to account for outcomes. For example, improving mortality. That's a really tough one. But we can actually measure reductions in smoking or reductions in obesity. And so, although those aren't the real outcomes that are being sought, I think those intermediate outcomes and indeed process measures may be useful at times. Fourthly, how should targets be measured and set? Quantification was the essence of this system. It's a good principle to pursue, but it is terribly difficult, and the National Audit Office reckoned that only about 30% of the measures were really statistically satisfactory. So that was really quite a serious problem. Another one was that there was a general feeling that the targets set were a bit generous, a bit easy. And this is a bit of a tension, because on the one hand, the received wisdom in the managerial literature is that if targets are to be successful, you've got to have about a a 1 in 3 risk of failure. So a two-thirds chance of succeeding. That's a sort of, it's a rule of thumb. So they then have the right mix of being stretching but not impossible. But most of the targets were attained in the PSA system, and of course the government naturally wants to be able to report it has achieved all its targets. That sounds a bit Soviet Union, doesn't it? But actually that is, there are some lessons from the Soviet experience for this. So I think there are some problems about that tension between the political imperative and the managerial. Fifthly, how should cross-ministerial targets be handled? I think I discussed that a bit already. These are amongst the most important but also the most challenging areas. And of course, in Canada, that problem is multiplied by the need to look at the joint efforts of federal and provincial government and the challenges that brings. So I think cross-ministerial, cross-government targets are a real issue that still need to be addressed. And finally, the thing that I was promising you at the start, I wonder, Greg, whether I could have a glass of water. What sort of accountability mechanisms should be associated with the targets? By that I mean, what are the mechanisms for doing something about the performance that we see from ministries? PSAs were very much geared towards one method of accountability, which was command and control. You will do what the finance ministry says and what the Prime Minister's delivery unit is enforcing. But there are other accountability mechanisms in our systems which are important and which can also secure improvements. 3 of them are the electoral process. To what extent should we actually be focusing these attainments, targets and measurement at the citizens so that they can make better electoral choices? Is that a better accountability mechanism? What about the market? Is there a sense in which there are parts of the public services where we can offer service users some element of choice, and they exercise that choice on the basis of information about the quality of service providers? One of the really underused, certainly in my country, underused mechanisms is that of professional surveillance. So getting the professions to check that their members are delivering acceptable services and that they are conforming with professional standards. That's a third alternative type of accountability mechanism. Now, the truth is that all of those accountability mechanisms are imperfect, but we need them all. And I think there's a question mark over whether command and control is actually necessarily the one to rely on to the exclusion of the others. So, it's difficult to argue with the claim that the PSA regime was successful in securing many of its objectives. It became clear, however, that there were problems, of which the Mid-Staffordshire example is one of the most appalling, but I hope exceptional cases. Nevertheless, it became clear that there were additional instruments needed to make it work, such as sustained political commitment to PSAs. We see in many, many countries targets being set and then more or less ignored thereafter. And that sustained attention was terribly important. So the second thing was this Prime Minister's delivery unit, which became a really important element in keeping, having regular checks on attainment By regular, I mean for the worst ministries, this is virtually a weekly meeting with relevant parties to check progress. There was clearly a need to continue monitoring and regulation and adherence to standards in areas that were not covered by the targets. It needed some pretty high-quality performance management skills in the ministries, some of which were not very good in that respect. It needed good mechanisms for transmitting ministerial targets to the frontline service providers, and of which the star ratings I described are one example. It needed strong collaborative arrangements for domains that crossed traditional ministerial boundaries, and that sometimes happened, but not very well. And there is a question mark over the extent to which the traditional ministerial structure is well suited to some of these really wicked problems. It needed careful integration of central and local government priorities, and that's a problematic area. There was a need with strong national data audit and surveillance, some of which was good, some of which was not really in place. And there was a need to engage the relevant stakeholders, including user groups, professional organisations, and the voluntary sector, amongst many others, and industry. So the PSA system offers a rich source of experience in what was almost a Soviet-style plan and control system in the public services. And I do think, as a shock therapy, it worked in some very important areas. In others, it failed. Now, I've no detailed knowledge of the Canadian situation, although I love Canada, and it's a great place to be. And of course, I'm aware of its extreme decentralisation and the interesting tensions that arise between federal and provincial governments. In fact, the UK is currently grappling with its own decentralisation, but it's a mere infant in comparison to your country. So, but notwithstanding the decentralisation, I think that many of the lessons are very similar, and certainly it's quite possible that there are issues within provinces that could just as easily be addressed to some extent by this sort of mechanism. And I think many of the lessons are universal. The PSA system was probably at its best when it was addressing urgent priorities for improvement. But it did need to take account of these other models of accountability. Most successful public sectors, in my experience, rely on none of those modes of accountability. That's elections, service user markets, professional oversight, or command and control. They don't rely on any of those exclusively. They have a mix of it. I'm taken particularly, for example, by the Dutch system of healthcare, which has a very rich mix of those elements in it. The common feature of all accountability is the need for high-quality performance information, required on a consistent basis from all relevant jurisdictions and service providers. So my advice would be to pursue the development of performance information as the fundamental fulcrum for all performance improvement efforts, and to ensure that, where appropriate, fully functioning democratic processes or opportunities for service users for exercising choice, or professional scrutiny, as well as public administration capacity, all those things are served properly by the performance information. Because when they're working at their best, all of these modes of accountability can take full advantage of that information to the benefit of service users and taxpayers, and indeed to all of us as citizens. So I hope that's given you something to chew on. I'm sorry I can't come to you with a whole series of answers to problems. I've probably given you more questions than answers. But at least I hope it's given you some flavour of what was quite an interesting experience in the UK public services. Once again, I've been delighted to be here, and thank you very much.
Peter, I want to thank you very much for your lecture this evening. It's not often that we get this kind of rich comparative experience, and I think the UK is quite unique in terms of what occurred in performance measurement. We've never had an experiment, I think, in any of the Canadian provinces or the federal government that's come close. So we really do appreciate this, and I'd like you all to join me in once again thanking Peter for this wonderful presentation and for coming all the way from London to join us here tonight.